Good morning. Good morning. Happy to be here. Great year so far. It's a little cold out there.
Yeah, it's
A little
freezing
cold
right
so
now.
far.
Hopefully by the time this comes out, it's warmer than it is right now outside because it's more than 14 degrees when I
Terrible.
head to the office. And so for this month, we respond to a lot of your feedback, and we're going to do something a little different. Normally, we like to tackle one specific topic, but this month we're going to go through a different progression, more of a rapid fire set of questions that hopefully to address more of the concerns that people are coming with us, because we like to tackle one thing and do a little deeper dive. But of course, at that point, we can't really touch upon a lot of things. So we're going to have a little more fun today and kind of just talk about some of the things we've been speaking with our patients in the hygiene rooms, questions we've been getting at the year wraps up, the year starts.
That's important. I like how you structured around getting feedback from our patients, what they want to hear from us. And that's why we'll roll into some products that we recommend that we do teach hygienists and what we talk to our patients about and recommend. So let's start. What's your favorite product for this year? I'm sure we have some overlap here because we do recommend similar products.
Yeah, I mean, we should, right? The product I recommend the most for my patients is based off of the patients who I see in the hygiene room who have the best health. Okay. So, as an observation, looking at people who do the best job, the outliers of our patients that are just impeccable health, impeccable teeth. And for me, the number one thing that I think all of our patients could use to improve their oral health would be a water pick. The barrier of that is one, that it takes up some volume in your bathroom countertop. And also, it makes a little bit of a mess. You have to fill it with water. Trying to get people to floss is seemingly difficult for some people, and then asking them to water pick could be even harder. You have to fill it up and use it, administer it, make it a mess, get a towel. But by and far, I feel like it does a better job because it's easier to do a better job with if you can get past those things. I see my patients that routinely use a water pick have less inflammation and have cleaner teeth.
So water pick is also on my top 3 list, probably for the same reasons that you just mentioned. And it's funny because I mentioned to my patients too that it could be a little bit messy, but nobody really complains about that. What I like about it is that you could charge it, it'll keep it charged. You don't have to keep it out on your bathroom counter. You can rinse it, put it back in your drawer. I actually sometimes put a little mouthwash in it, mix it with the water, not straight mouthwash. I like to dilute it. I even use it in the shower sometimes. So it's more of a mess in the shower. So that's on my list.
A lot of patients do. They have a smaller portable unit that you can charge, like you said. And for people who do not want to take it out on their bathroom counter, they can use it in the shower. And then you said the only problem with that is you have to fill it up a few times to get your whole mouth.
So the portable one is the water flosser, which is made by Waterpick. I kind of feel like that's a proven brand. I like to stick with that. There's some aftermarket ones on the market that you'll see, some other products through Amazon. Price-wise, I mean, you're better off going with the Waterpick. They're very similar in prices.
Would you recommend the device that it's like a bite plate that goes into your mouth and it sprays water all at once in your entire mouth?
It's like a car wash. It's supposed to. It's got to be a mess.
Remember one of our friends sent us that on a group text recently. And so we do not feel comfortable recommending these one-off products.
I agree. It's the same thing now. My second product, which I'm sure we have overlap on, which I don't recommend non-brands that I don't know of, is the electric toothbrush. And I like to stick with either Sonicare or Oral-B. As far as favorite products, the Oral-B has a lot of AI technology built into it. It's got pressure sensitivity. It'll tell you if you're missing spots while you're brushing. It'll tell you if you're brushing too hard. These are nice to tie into an app if you want to do that. I like the Sonicare by Philips also. It's a bigger head on it. I'm not sure what your preference is, Rob, but it's funny because my wife will use the Oral-B. I'll use the Sonicare. And they're both just as effective.
We have the same exact situation in my household. I think that patients who need to be mindful of brushing too hard should use a Sonicare. The Oral-B is a little more aggressive than the Sonicare brush. So if you're using an electric toothbrush and a water pick, you're so far ahead of, dare I say, the average person or where you could be. What's your last product that you love for this year?
I got 3 more things that are really non-technology. One is I always push, the tongue scraper. I always love the tongue scraper to use every day, just to take it on the back of your tongue and pull it forward. That's simple. Dr. Tongue's tongue scraper works great. I've been talking about that for a while. No, what I also start doing, and again, we do a lot of, 50% of our practice is probably implant dentistry. I'm going back to old school proxy brushes. What I see is people are flossing around implant crowns, and they still, if they're lazy with it, they're getting decay on the teeth next to the implants. So whenever I deliver an implant crown, I like to show them the proper size brush that can go in the embrasure between the implant crown and the tooth adjacent to it, and to help clean that out. What we see through years is that implant crowns don't move and natural teeth do move, and sometimes that space opens up and the flossing may not be enough to clean there. One more thing, which I want you to talk about, which I know you talk about a lot, is hydroxyapatite toothpaste. Some people these days are more sensitive toward fluoride, or children, and don't want to use a fluoride-based toothpaste. And how do you feel about the hydroxyapatite helping to mineralize the enamel?
The best approach is alternating a fluoride toothpaste one time during the day and the hydroxyapatite. The hydroxyapatite has some benefits where fluoride do not, right? And that's one is it naturally whitens your teeth. The other is that it actually naturally can help with sensitivity, better than potassium nitrate in a sensitivity fluoride toothpaste. And the other thing is that there's a line going now that fluoride sensitivity in water and other places. So my smallest child uses hydroxyapatite toothpaste because she's going to swallow it. So I don't
Great
need
for
her.
children, great for pregnant women,
Great.
Or people with sensitive teeth.
And it's a nice product, but you want to make sure with that just to get nano hydroxyapatite. Unfortunately, they sell some normal hydroxyapatite toothpaste. That's pointless. That's going to have no action in the remineralization of your teeth. It's only going to, go into your teeth and then wash off. So you want to make sure you stick with the nano hydroxyapatite. I like Risewell is a really nice product. Risewell is the one that I use personally. I think what is the most important thing we're talking about right now is putting the ownership on our patients on what they do at home might be the most important part of their long-term health, right? If you're at a baseline health, you're a patient of ours or wherever you are, and you're at a good baseline, the best way to maintain that is to be proactive yourself with your specific tailored home care for yourself that's going to make sure that you can minimize your risk factors, whether it's tooth decay or gum disease, grinding, you have GERD, you have acid, whatever it is, it's important. Like that's what I think Mark is really stressing with here, is that why he has a couple of different products that he loves for the year with his patients is because there's not one thing that works for everyone that's the best thing. Just like the electric toothbrush, Oral-B, Sonicare, what really is going to help you the most is probably what would be the best thing for us, for you in the year to follow.
And to have a consistent routine, to be consistent. And with all this, the water flush and all, we still recommend the flossing prior to brushing.
On that same theme, what are a couple of your least favorite products?
Least favorite products. Okay, let's see if we have some overlap here. I've got two that jump out at me. One is a hard toothbrush. Well, I don't even know why they sell hard toothbrushes unless you're cleaning a denture with it.
To clean your sink.
Right, or my wife will clean her jewelry with it.
Yeah.
There's no reason to ever have a hard toothbrush. They don't clean better. In reality, they damage the enamel, they damage the tissue, and they can lead to more sensitivity and recession.
Yeah, so my first thing that I wrote was all manual toothbrushes. I don't feel that most people can do a good to great job with a manual toothbrush, right? I think the best manual toothbrush, these smaller end tuft brushes, right? It's almost like a quarter of a toothbrush in length and therefore hard to get places, like a wisdom tooth back behind a lower molar, below your anterior incisors, just clean that. And I like to have my patients use these smaller brushes in conjunction with an electric toothbrush. I mean, we're adding more things at home, I know.
That's the problem. You get someone to brush, and now, okay, you have to use two different toothbrushes to try to get a patient to switch and say, use this brush for the back molar. And that goes back to why we recommend the electric toothbrush. I think you could solve everything with that. So I have one other least favorite product, charcoal toothpaste. Charcoal toothpaste, it's a myth that it really whitens your teeth. Basically, in reality, it's doing more damage than it is doing whitening.
So how is it whitening your teeth?
It's abrasive. It's removing maybe a little bit of plaque that you can just take care of if you brush your teeth and floss routinely. So it's just really cleaning the surface a little bit better. It's not going into the tooth. It's not whitening the tooth. In reality, the abrasive particles are going to erode away the enamel.
And gum tissue.
And the gum tissue, causing more permanent damage. And this is the same with the whitening toothpaste that are on the market. Maybe not as strong as a charcoal, but they have abrasive particles that will affect the enamel.
We like to recommend these to a patient before an event, right? You have a wedding to go to, a performance, you have a presentation, you have photographs of yourself, using it sparingly right before an event, but it is at no level something that we recommend our patients use regularly. My other product is mouth rinses.
All of them, huh?
Well, here's the problem. There's only a couple that are really good. Most of them, 90% of them, aren't worth their money that you spend on them, right?
You're not going to tell me you're against root canals too now, are you?
No. Oh my God. I think most mouth rinses are either misleading, where they're not actually doing what they say, or they're causing harm by having alcohol in them and dehydrating your tissues. So, for example, we have patients that use ACT every day. Now, if you're using a product with alcohol in it, well, you're dehydrating your system. I also find that it's misleading. Well, I rinse with ACT every day. I rinse with the over-the-counter fluoride rinse. why am I getting this tooth decay? Well, the problem is that that's actually not doing much to prevent it. It's too low a level of fluoride to help. The other problem with a lot of mouth rinses is that they kill your microbiome of your mouth, right? We talk a lot about probiotics. Well, this is the opposite of a probiotic. It's actually wiping out a lot of the bacteria of your mouth, leading for opportunistic bacteria to be able to infect your gums, infect your teeth. So if I had to say, we're adding a lot of things, you and I, in recommending interproximal brushes, water pick, toothbrush, different things, it would say you could avoid the mouth rinses and just use water.
I think it's misleading. People rinse, they have that minty, fresh taste in their mouth, and they think their mouth is clean. But let's talk about products that we're bullish or bearish, which we're in favor for, which we think has a positive future going forward, and what's declining in dentistry and maybe less useful in the future.
All right, so I'm not going to spend any time on it, but probiotics. I'm still super bullish on probiotics. I've talked about them on every on every recording we do. So that's it. I'll just say probiotics. But the new thing that it's not new, I shouldn't say that, but at home sleep tests, I'm more bullish on this than I used to be. I think that they're going to have more of a place in our profession and in people's health. I think they'll be more commonly used and more impactful because we used to always refer our patients to physicians that support sleep center tests, right? But we find that those results are not as reliable given that you're in a center being watched and cameras on you, devices on you, where I think that we're going to do a better job in the dental profession with at-home sleep test. The other thing that I'm bullish on is, more recently, influencers are becoming more and more popular in health, right? We saw a big boom of people paying better attention to their health during COVID. And now, because of that, there's been a huge market of health influencers. Part of the problem with this is what I'm seeing is that there's a lot of taglines and kind of things that they're talking about on social media and that gets picked up on the news that probably isn't as significant as they're making it seem. So what I'm bullish on is the scientific method. People understanding how science is done, how to interpret results, and then how to take those results and actually take action items in their own life to do the right things and not things that are misleading, to understanding how science is done, to not do things on emotions and opinions as much as you can on actual found literature and research, things that work, don't work, and make the proper decisions in your life and not just kind of following a fad.
So never following unproven trends, basically.
Yeah, check yourself before you wreck yourself, Mark.
That's Rob. Rob, I'm bullish on digital dentistry and 3D printing. I was shying away from it. Digital dentistry has been around for a while, and we kind of jumped into it about 5 years ago. It's kind of like waiting for the iPhone 20 to come out. Eventually you got to jump in and do it. We're not doing digital dentistry on everything, but it's certainly simplified our life. I think it's the future. The flip to that is I'm kind of getting against the gooey impressions and taking a lot less impressions on my patients. I think digital dentistry is the trend. Patients love it. I think it's a lot more accurate when we scan for restorations with a camera as opposed to taking impressions. I find it simple. Patients enjoy it more and the workflow is easier.
Do you find that you can get to a better position faster, better solution faster for patients using digital dentistry?
I do, yes, especially from diagnostic planning, right? We just scan the mouth and then before the patient leaves the room, you can be designing their mouth in the computer instead of taking impressions, waiting them for the dry, taking out wax and making it in wax. It's all done in a 3D world.
What are a few things that you're bearish on?
Well, again, I overlap that with impressions. I still take some impressions, but I'm trying to get away from taking impressions on patients. So the more digital I do, the less impressions I'm taking.
For me, composite fillings.
Plastic fillings.
Really bearish on this. I think technology is coming along, like you mentioned, scanning, intraoral impressions, being able to work with a digital workflow. I think that composite fillings, direct fillings will be going away in our profession in the future.
So what's the workaround if it's a small, tiny cavity?
I think ceramic, same day milled ceramic solutions will be part of our profession in the near future, I think, where we'll be doing very little bonded fillings. A little bonding on a front tooth that's chipped, that's different. But in terms of the day in, day out, smaller cavities that we treat right now with bonded fillings, I think that'll go away. And you'll be able to make a fast, accurate, stronger, better solution for that patient in office, real time, in a single appointment. I'm definitely trying to avoid placing plastic in people's mouth. And on that same level, I think plastics in dentistry is something that I'm somewhat bearish on. I think people are going to reconsider things like Invisalign and other type of plastics that introduce microplastics into the patient's body. I think that's something that'll be becoming more of a conversation. I mean, I'm hearing a little bit now in the medical world, and there's a lot more studies coming out around microplastics more the past few years than a decade ago. So I think that's going to become more of our conversation over the next year or two in what we do, because right now plastics are utilized in a lot of things. Luckily, the occlusal guards that we make are not ones that spit off microplastics.
Right, the printed ones.
Yeah, the 3D printed materials that we use do not introduce microplastics, so we're safe there. But I think for like routine Invisalign, there'll be a huge conversation about that, and people might go more traditional braces than they are doing clear.
That's because all the Invisalign trays are made with microplastics.
Yeah, they spit off microplastics into someone now, so a short-term treatment's not a big deal. But if you're wearing those trays for a year or two, you're introducing a lot of microplastics into your body. And I guess on that, health influencers is something I'm bearish on. Just people following these trends,
Unproven trends.
Yeah, because I think as AI comes out, and that's something I'm bullish on, as AI gets introduced to our everyday life, you'll be able to ascertain information faster. So, for example, if you wanted to understand the research around fluoride in tap water, AI can do a really fast job at reading all of the articles around that and actually assessing risk faster than you and I could go through 100 articles, right? 1,000 articles. It's just you don't have the time to do it, and then understand the risk and the quality of the articles. Actually read the articles and weight the articles on how good of a study it is or not, and then understand the actionable item around that. I think as AI comes, less of these trends with influencers you'll be able to research things a lot faster. So maybe more accurate information from influencers will come about. Let that be the hope.
Speaking of AI, which a lot of our patients are getting excited about, which I'm bullish about, is we have the AI overlaid onto our x-rays now. So we take x-rays on the patient, the software immediately reads it, will show us where the decay is, will show us where cavities are, will show us where there's bone loss or possibly infections around the teeth. Probably not showing you and I things that we don't know or we don't see already, but visually it makes it easier for the patient to understand.
You would agree it enhances our practice, right? It
Yeah,
enhances
yeah.
how we practice
Absolutely.
from an actual information standpoint,
Yeah.
not just like a bell and whistle thing, right?
Correct.
All right, so what's something you would never do as a prosthodontist?
Oh, wow. So I do a lot as a prosthodontist. I clean my own teeth. I've given myself injections, but I've never filed my own teeth. I have patients that come to me, I had a sharp corner of my tooth. I took out an emery board or a little tool, and they start putting files and tools in their own mouth.
Yeah, so my answer is I would never bite into things with my front teeth that were hard or use my teeth as a tool. So I'm the precursor and you're the after effects. So we're 100% on page, right?
That's great.
That's really funny.
So what is something besides flossing and brushing that you would recommend every patient to do?
This is something that people always ask us. What's the one thing? What's that? And so what I would say is for every patient is to assess what their risk is for specific things. We have patients who are more prone to gum disease or tooth decay or something else. So I think the one thing every patient should do is figure out what their risk factors are and address those first.
I have two things. One, which you mentioned earlier, Rob, was the probiotics. I think every patient, besides brushing and flossing, should be using a probiotic. We introduce it in the hygiene room, give the patient the opportunity to purchase on Amazon and use it every day. The other thing is, most of our patients are on 4 or 6 month recalls, but there are some of them that just come in with that broken tooth. I suggest routine visits over reactive visits. People come in when something's broken. Sometimes that could have been an easy fix if you saw it 6 months ago on a hygiene exam instead of waiting until the tooth fractures and maybe it's an extraction or a root canal. So I think if a patient's more proactive instead of waiting for something to happen, I think it's best to support their oral health.
We always see people who are on top of their health in our practice, from their home care to their appointments, need less dentistry and smaller dentistry through the course of their life. Right? Smaller things, less expensive things, less bigger things, less complications. The people who stay on top of their appointments and their radiographs and their home care have a better long-term trajectory of health.
And it's proven. If you look at COVID, right? We came back after COVID and there was so much dentistry to be done because people missed their 6 month, their recalls without a dentist for a year or so.
Pretty amazing. I really enjoyed this.
It's great.
I like this approach of just bouncing around a little bit. Let us know what you guys think about this. And if you have any more questions, anything we could address, things we didn't get to. This is fun. Great job, Mark.
Yeah, our patients make this the best. So I appreciate all the questions you ask us, any topics based
Yeah.
around dentistry that
Continue
we
the
can help
feedback.
you.
Yeah.
Thank
Thank
you.
you so much.
Great.